Hello and welcome. You're listening to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. In this segment, we're going to be speaking with Dr. Phil Hart. He's joining us here to talk about why some Americans are suffering in silence when it comes to GI symptoms. May not be aware of a very serious condition, exocrine pancreatic insufficiency. Welcome to Health Professional Radio, Dr. Hart.
Great, Neil. Thanks for having me.
Right. Give us a bit of your professional background, if you would, and talk about your current role at The Ohio State University Wexner Medical Center.
My background in training is as a gastroenterologist, and I've completed some additional training and have a dedicated practice in what I refer to as medical pancreatology. In other words, I have a dedicated focus and interest in patients with known or suspected pancreatic disorders, as well as complications of pancreatic disorders such as exocrine pancreatic insufficiency or EPI.
Now, there was some information that was presented at the American Gastroenterological Association revealing, as I said, that there are some who are suffering in silence when it comes to GI symptoms. Why would someone suffer in silence with something that is potentially so severe?
Yeah, so we recently completed a survey to try to understand patients' understanding and perceptions and awareness of exocrine pancreatic insufficiency. And we collected information from over 1,000 adults throughout the country to try to understand the frequency of symptoms, as well as, again, just basic understanding of exocrine pancreatic insufficiency. Now, we were surprised to learn that almost 50% of respondents had experienced some type of a GI symptom over the last year that significantly impacted or disrupted their daily life or activities. One of the things that we found that was concerning in that, though, is that even though having symptoms was very common, almost a quarter of people who had symptoms never sought medical attention. While we didn't dive into all of the specific reasons behind why a person may not seek medical attention, there were some initial things that we learned and other things that we could certainly speculate. And you can imagine a number of different scenarios as an individual. I mean, we've likely all experienced some GI symptom from time to time that may prevent you from seeking care. Things such as the symptoms resolving on their own or just being mild in nature, in many regards would be acceptable. However, in our survey, we also learned, though, that a number of people seem to maybe not have the alarm system set properly. In other words, many patients may be experiencing symptoms but not think that it's a big deal, and as a result, not bring that up to their healthcare providers.
What is exocrine pancreatic insufficiency? What causes it, and who's most at risk?
EPI, again, stands for exocrine pancreatic insufficiency, and this describes a situation where the pancreas is either unable to make enough or release enough pancreatic enzymes to properly digest food. There are a number of different clinical scenarios where we can observe EPI, and these include the diseases of the exocrine pancreas, such as chronic pancreatitis, acute pancreatitis, pancreatic cancer. Now, this is also seen in a number of other scenarios that may be less common, but these would include things like cystic fibrosis or the rare Zollinger-Ellison syndrome. So there are a number of different clinical situations, and certainly in patients who have a known disease of the pancreas, when they begin to experience symptoms, EPI is something that, as clinicians, we should be considering as a possibility.
Now, I understand that there's an EPI campaign called Exposing EPI. It's an educational campaign. Could you give us some insight into this campaign and talk about your involvement?
Sure. The American Gastroenterological Association has always been interested and committed to providing education to both patients and healthcare providers on a wide variety of gastrointestinal symptoms and diseases. However, they've recognized, and what's triggered the timing of this recent campaign is that the COVID-19 pandemic has created a number of additional layers of separations between patients and their providers that for which there's concern that patients may be suffering in silence. And if people remember nothing else, we want to encourage the patients and healthcare providers of this reality and to encourage, patients to raise these symptoms with their healthcare providers and resume their regular checkups and cancer screening measures. So that was really the impetus for launching the campaign at this time. Again, as I mentioned, what we had learned, and one of the things that we had concerns that may be the case is that many patients, again, whether it's directly or indirectly related to the pandemic, may be at home, suffering in silence with symptoms that could potentially be the consequence of a serious condition and or a condition that is otherwise easily treatable if it's diagnosed and properly managed.
So basically, for some people, the symptoms have to be so severe that they seek treatment. Otherwise, they think it's a mild case of gas or something like that, when in fact it could be EPI, and if left untreated, it can cause some very serious health issues.
That's right. And one of the things that was a concern that we found in this survey is that when the survey participants were given a list of symptoms and asked, if they had the symptom, would they bring that up with a healthcare provider? 25% of respondents said that they responded no to everything. Okay, so none of the symptoms would have triggered cause for alarm from them. And among the list of symptoms were things such as unexplained weight loss, foul smelling and oily stools, and bloody stools. And you can imagine these are what healthcare providers recognize as alarm symptoms that warrant further diagnostic evaluation. However, a key group of patients at home don't think that these are anything to raise to their providers.
So obviously, exposing EPI, the campaign, is doing a great service to those who are just unaware of the seriousness of EPI and other GI conditions.
Yeah, that's our goal, and the awareness is in multiple levels. I mean, so obviously we want patients to know and to understand that these are concerning symptoms that they should feel at liberty to bring up with their providers. And as I mentioned earlier, it's also the situation that we're in the course of things with the pandemic that people may have been suffering at home for almost a couple years now, and we want to encourage them to bring that out into the open. On the other side of the coin, we also want to raise awareness with healthcare providers that there are many patients who are out there who have symptoms that may not volunteer them, again, for different reasons that are difficult to tease out in a survey like this. In previous work that the AGA has done and been behind, we'd also learned that a number of patients are just too embarrassed to talk about the symptoms. The encouraging thing, though, is that if you also take into the consideration that although they may be too embarrassed or nervous to bring that up, primarily if their healthcare provider brings that up, then the vast majority of people feel comfortable to have that conversation. And so in that regard, the awareness and the key point for clinicians is to not assume that just because a patient doesn't mention one of these symptoms or problems that may be related to EPI does not mean that a person isn't experiencing that problem. And so just to encourage them to explore this as a possibility.
Give us a website where our listeners can learn more.
For those who are interested in learning more about EPI and other GI symptoms and diseases, we encourage going to patient.gastro.org, which is a suite of informational resources that are developed and provided by the American Gastroenterological Association.
Great. Dr. Hart, thank you so much for joining us on the program this morning. Appreciate it.
Yeah.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Phil Hart. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.